Hello, NephU community. My name is Leah Beaird, Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization. I'm here with Molly Cahill to give her personal perspective on the field of nephrology nursing. Molly is a nurse practitioner in a private physician group with over 30 years of experience as a nephrology nurse. She provides education, counseling, and medical care to patients in all aspects of nephrology, including acute care, CKD, and dialysis. As an integral part of the interdisciplinary team, Molly coordinates care for more than 350 patients in dialysis clinics. Molly serves as a preceptor for both undergrad and graduate nursing students. Additionally, she is a mentor for new nurse practitioners in her nephrology practice. Molly is a leader in the nephrology community. She is involved with ANNA leadership at both local and national levels, has served as committee chair, and currently holds the position of secretary. Thank you for joining us. So Molly, let's start with, what does nephrology nursing mean to you and why did you start?
It's an interesting story. I actually was assigned to the nephrology floor as a nurse aide by accident and stayed on purpose, is usually how I shorten the story. But in the process of nursing school and my transition through my nursing career, starting as a nurse aide in pre-nursing, ultimately I was assigned to the nephrology floor, and my father died of kidney disease just prior to starting dialysis. So what I actually tell a lot of people is I started by accident and I stayed on purpose. I developed a passion for education, awareness, teaching patients, because I believe knowledge is power, and the more they know, the more they are able to do to help themselves.
That's fabulous. Thank you for sharing that with us. So my next question, what is the biggest reward within your profession?
Is giving patients the tools to make a difference in what they do to care for themselves. One of my biggest challenges is teaching at all levels of education, from or disabilities, people who are blind, people who are deaf, people who are limited on education, people with mental health disabilities, and the challenge of teaching them in a different way the tools they need to delay progression. And CKD education, to me, is the most important tool we can arm this population with in terms of disease, diet, anatomy, medications, everything they need to know.
Okay, Molly, next question. What is your biggest challenge being a nephrology nurse?
I think I would say that the complexity of the patients is a big challenge. You have to understand heart disease. You have to understand diabetes. You have to understand immune and acute diseases, hypertension, and putting that whole package together presents challenges, and I think it presents challenges and opportunities. And then the other thing that I would tell you is it's a chronic disease, so there are happy events and sad events, and patients denied transplant, and that's super sad. And the polypharmacy and the number of patients that they have to take, number of medications that they have to take, that's a big challenge. And knowing and explaining all of the medicines to them is also a challenge.
Can you tell us about a memorable patient experience?
I have two. The first one is one of my best friends in life called me and had been admitted to the hospital with 14 grams of protein in her urine, and they were talking about doing a kidney biopsy. And I was not affiliated with the hospital system where she was. Ultimately, the best thing to do was proceed with the biopsy, and then ultimately I got her in with one of the physicians in my group so that I could follow along with her. And I would tell you what was so amazing about it is I felt like I taught her a lot, because she was diagnosed with FSGS and needed to be on high-dose steroids for a very long period of time, which is super scary as a provider, understanding what that could mean. And I taught her so much about blood sugar and carbohydrates and management that she is the first person that my physician nephrologist, who happens to also be my collaborative, said to me she's the first person he's ever put on high-dose steroids who lost weight. Exercise, diet, paying attention. And then through her, I learned about plant-based diets. And I ultimately studied so much about them, I presented about them, and delaying progression of disease and what it means for CKD and proteinuria. She actually has decreased her protein. Part of it was prednisone, and the disease is in remission, but she has no protein in her urine. That's the first one. The second one is that one of my best friends, also a different person, has polycystic kidney disease, and in their family, I was with her in Anaheim at an ANA meeting when she got called about her transplant. Ultimately, I now work with her. She is a nurse practitioner with her DNP, and am proud as heck to be a part of her life in this journey on all aspects.
Do you have any advice for nursing students who are thinking about specializing in the nephrology field?
Just do it. I think there is so many opportunities, inpatient, outpatient, acute care, working with machines, if technology is your thing, CRRT or the hemodialysis machines are super complex. But the challenges, the complexity, multiple diseases, I love the field, and I take students and I try to push my passion on them, hoping that they'll stay. And I believe that I've nudged a few people in the direction because of getting exposure to so many different areas of practice.
Okay, how have you seen the nephrology field evolve in your 38 years being a nephrology nurse?
A lot. First with technology and the machines and what we're able to do with ultrafiltration. The dialyzers have gotten more complex. The drugs, more recently, I can't be more excited about drugs that'll lower potassium, the potential for oral medications to treat anemia. We're seeing new drugs on the market for diabetes, for polycystic kidney disease. This, to me, is huge because we've for so long managed anemia, managed mineral bone disease. But to be able to take it to the next level and treat the diseases that are causing this process for this huge number of patients, to me, is so exciting. You know, I mean, way back, I saw what the ESAs were able to do for anemia in eliminating or markedly reducing the need for blood transfusions. But more recently, am even more super excited about what's on the horizon.
Do you have any educational or professional achievements you would like to highlight?
I'm proud of my publications. I have co-authored or authored chapters in several of the nephrology books. The contemporary nephrology book and the core curriculum. I've done work on cultural diversity and patient and family education. And then also I have done work on mineral bone disease in adding to the contemporary nephrology book. I also was recognized for leadership, which was incredibly touching to me, with the Ron Brady Award through ANNA. And locally in my National Kidney Foundation area, I received an award for a couple who started the foundation locally in the Kansas City area, and it was the Patrick and Virginia Clune Award, mostly given to physicians originally. I was one of the first nurse practitioners to receive the award, and it meant a lot to be recognized among my peers in the area.
What part do you see nephrology nurses playing in advancing kidney healthcare?
Endless possibilities. I'm, again, charged up about the executive order and think nurses are going to take charge. I think nurse practitioners are going to be a huge necessary role in education, prevention of progression, which is part of that. I think the ANNA is putting a bunch of tools in place to educate people about what's going to need to happen in order to be able to do some of the things of home dialysis and increasing the number of patients who are at home, which already should have been part of what we want to have happen. It's difficult, and there's challenges related to staffing and having enough people to be able to train and take care of and manage that number of patients. And then the challenges associated with the transplant piece, and I usually don't speak to that. It's not one of my specific areas of practice. I do have expertise in it in terms of my time in the field. I worked on the nephrology floor, and then I've also worked with transplant patients in the office, so I'm familiar with it. I've also referred patients to be evaluated for transplant and worked with them in getting to multiple facilities to pursue all of the processes that are related to either single kidney transplant or dual organ transplants, because we've referred a lot of patients for kidney heart, kidney liver, kidney pancreas, and what an amazing experience to be involved in. As an ANNA member, I have met colleagues and professional people who I can contact at a moment's notice all over the country. I have friends who I now travel the country with at a meeting or because we've made friends. I have people I can contact for a practice question, or people who I can call because I'm nervous about something that's happening in my life, because they're now my friends after 35 plus years.
What do you like to do outside of nursing, and what are your hobbies?
I am married, 35 years, and I like to hike. I like to travel. We have kids and grandkids we spend time with, and I enjoy celebrating life and time with people that I love.
I want to thank Molly for joining us today and shining a light on the nephrology nursing field. Thanks for tuning in, and we hope you enjoyed the discussion. We will see you next time here on NephU.